In BC today, a shift in back-to-school plans to give more time for teachers to get ready.
Working together at the beginning of the school year, and then some kind of gradual reintroduction of students.
Exactly when kids will go back isn't clear. Another COVID uncertainty in a time when we're still learning just how the virus affects children. One constant, children do get COVID, but with generally much milder symptoms than adults. But there is a lot we don't know, like why a small number develop a rare inflammatory disease.
It starts off with fever, sometimes having a rash, and then very quickly the kids develop all kinds of symptoms where we see huge signs of inflammations in the blood.
And then there's the issue of transmission. A recent study in the Pediatrics Journal of the American Medical Association found children under 5 have more COVID genetic material in their noses than adults.
You would expect that they'd be able to transmit that virus at a reasonably efficient rate to others. We haven't really seen that.
The American Academy of Pediatrics found that more than 97,000 children in the U.S. contracted the virus in the last 2 weeks of July alone, a 40% jump in the cities and states they looked at. But Canadian health officials caution Canada's situation is different, pointing out the WHO recommends a testing positivity rate of less than 5%, like Canada's, to reopen schools, a recommendation not all U.S. states are adhering to.
We wouldn't anticipate getting as many cases you might have with school reopenings in other parts of the world.
And those U.S. cases may provide vital information.
Until we have that data, we're not as scientifically reassured that we're right in what we've been saying all along.
I think we'll have similar opportunities to figure out what works and what works best, especially with effectively 10 different policies across Canada.
Which means Canadians will have to continue to be nimble as this pandemic progresses. Susanna De Silva, CBC News, Vancouver.